What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we'll cover how often does the state come to your hospital for inspection. So to give you context, I work at a trauma 3 ER hospital. Work night shift. Been doing it for 4 years. Work a lot of overtime, so I do dabble in day shifts. So that being said, state usually comes during the day shift, like when all the upper management and all them people are there, that's when they come. So typically since I've been there, they never come during the night shift. Occasionally we might see them coming as we're leaving, but typically the day shift crew is the one who deals with them. And usually it's not that they come strictly to your department. They're there maybe just observing the hospital as a whole, or if there was complaints of certain stuff, or just their yearly stuff, and then occasionally they'll dabble within your department. And usually they'll come in and make sure you're up to code, everything's clean, everything's safe, and up to protocol. And they'll ask you certain stuff, like safety stuff, for that's standard for your hospital or for your stay or for your department. And they'll ask you or the paperwork or certain basic stuff like that. Usually if you stay busy and you're working on patients, they kind of don't bother. Usually what will happen is your upper management will be the one kind of dealing with all the questions, dealing with all showing them around, explaining all the stuff. And occasionally you may get chosen to partake in what was happening, but most of the time, as long as you're doing what you're doing and you make sure everything's safe and HIPAA and radiation safety and all that's up to code, usually we do pretty good. Because especially I know sometimes certain people will have their food, water, and all the little jumbo at the workstation. Technically you're not supposed to have it because it's a safety hazard type stuff. So there's certain stuff that may have to be rearranged and stuff. But in the simple sense, if you work night shift, you really don't have to do that. Occasionally you may be asked by your manager to help prep a little bit before day shift gets there, in case the state comes, to make sure you're ahead of it a little bit. So that's something that can happen. Yeah, it's been your boy Miguel. Hope this information is informative, and see you on the next one.